Hi students, welcome to my channel. Today we are going to see hysteria. Okay, the hysteria in mental health nursing. Okay, here we are going to discuss about what is hysteria, what is the clinical manifestations, its type, what is the diagnostic procedures, what is the treatment pattern for the hysteria. Okay, so let's start with the hysteria introduction. Introduction. Hysteria, it is a state of anxiety where a person hides his feelings and show dissociative personality. Okay, so it is a state of anxiety. This is condition related to the anxiety disorders. It is a state of anxiety where a person hides his feelings and show dissociative personalities. And most probably hysteria is affected for 2% of the population in India. Usually it affects for approximately 2% of the population in India, and it is common in women than men. It is more common in women compared to men, and it is prone for young women and adolescent girls. Is most probably you can see in the young women and adolescent girls. So this is about the introduction. That is it is hysteria. It is a state of anxiety where a person hides his feelings and show dissociative personalities. Yeah, the person is going to hide his feelings and he shows dissociative personalities. The hysteria affected 2% of the population in India, and it is most common in women than men, and it is prone for young women and adolescent girls. Types of hysteria, 4 types, and the first one, hysterical episodes. Second type, mass hysteria. Third one, conversion hysteria. Fourth one, dissociative hysteria. Okay, now we'll see what is the types of the hysteria. So first one, historical episodes. That is, under the historical episodes, what is that historical episode means? The patient is unreliable and exhibitionist. Okay, the patient is unreliable, yeah, and he shows dependent and flamboyant type of feeling where he thinks he is superior to all peoples and nobody can beat him. He will always think he is the superior. He feels and he thinks he is always superior to all the peoples and nobody can beat him. Okay, nobody can beat him or nobody can touch him. Okay, other signs and symptoms of the historical episodes are fantastic lies. Always he used to tell lies and attention seeking. He always try to grab the attention of the peoples and craving for appreciation. Eager to get the appreciation from the peoples and manipulation. He is going to manipulate the things and situations. Okay, because always he feels that he is the superior for the all the peoples. And second one is mass hysteria. It is persisting in group of people who shows common hysterical symptoms at same time. See, mass hysteria means mass in the group. It is persisting in group of people who shows common hysterical symptoms at same time. And the third type is conversion hysteria. That is conversion hysteria. This is defined as the unconscious process through which is converted into physical symptoms like hysterical fits, hysterical paralysis, blindness, aphonia, etc. See, this is defined as the unconscious process through which is converted into physical symptoms like hysterical fits, hysterical paralysis, blindness, aphonia, etc. And fourth one, dissociative or hysteria. This is an anxiety relieving hysterical problem. Here the person dissociative with self and acts in a new manner. Characteristics of dissociative are hysterical amnesia, first state. Okay, it's going to forget. Hysterical amnesia or fugue state. Second one, hysterical translate. Okay, going to translate. And multiple personalities. Okay, this is the type 4 dissociative hysteria. Next is the management. How we can treat the hysterical hysteria patients. First one is hypnotherapy. First step of the management is hypnotherapy. That is, it is the process of controlling brain's activity by others as the patient is under semi-consciousness state. The feeling of the patient are revealed during the hypnosis. See, hypnotherapy, I'm just going to start the hypnosis. Going to hypnotherapy to the patient. It is the process of controlling brain's activity. Particularly what they will do in the hypnotherapy, we're going to process the controlling of brain's activity by others as the patient is under semi-conscious. When patient is in under semi-conscious state, at that time, other people are going to process of his controlling brain activities. And the feeling of the patient are revealed during the hypnosis. The feeling of the patient at the time he feels reveals. And second one is psychoanalytical psychotherapy. Second management method is psychoanalytical psychotherapy. This method builds new mindset that makes the person to relieve anxiety, hysteria. See, this methods builds a new mindset of the patient, makes the person to relieve anxiety, helps to relieve the anxiety. And third one is pentonal analysis. Here, in derivative of alcohol is introduced into the patient's body and made the patient to be semi-conscious. Yeah, in derivative of alcohol is introduced into the patient's body. Alcohol is going to introduce into the patient's body and made the patient to be semi-consciousness. And the patient mind is read and anxiety cause were found and treated. After introducing the alcohol into the patient's body, here they are going to read the patient's mind is read and anxiety cause were found and treated. And drug therapy, as the patient is suffering from anxiety and mind depressions, he or she treated with anti-anxiety and antidepressant drugs. Going to treat with the antidepressants and anxiety drugs such as haloperidol, trifluoxetine, and hydrochloride. This is about the drug therapy. So, main nursing management of the hysteria. First, the nurse has to, what are the things has to do? First one is nursing management, nursing preventions. First one, as the patient is anxious and feel insecure, the company of nurse is essential. Okay, if patient feels anxious and feel insecure, at that time the company of nurse is essential. The nurse has to give the company, has to read about the patient's mind and okay. And history collection and mental status examination, it can help to identify the cause of anxiety. History collection and mental status examination has to be taken. It helps for the identify the cause of anxiety. And withdrawal attention, if the patient continues to focus on physical limitation. We have to withdraw attention if the patient continues to focus on physical limitations. And fourth one, encourage the patient to verbalize fear and anxiety. You have to encourage the patient to verbalize and fear and anxiety. You have to encourage the patient to verbalize fear and anxiety. Explain the encourage to the patient to verbalize, to speak about his fear and anxieties. And do not focus on the disability of the patient. We cannot do not focus on the disability of the patient. We have to avoid the focus of the disability of the patient. Encourage patient to do self-care activities as independently as possible. We have to encourage the patient to do self-care activities independently if as possible. And interfere only if patient need help. If patient cannot able to do perform his self-care activities, at that time we have to give the help. And positive enforcement. We have to keep always positive reinforcement and identify specific conflict that remains unresolved. So this is about the nursing management. Thank you.